Please don't skip this video. If you are a pregnant woman, you're planning to get pregnant and you don't know what scan is all about. Because on this video, I'm going to be sharing with you 3 scans that you should do during the course of your pregnancy as a pregnant woman. I see a lot of women doing a lot of scans, 8, 9, 10 scans in pregnancy before the baby arrives. So I'm going to be telling you the particular scan, these 3 compulsory scans that you should do during the course of your pregnancy. And for those that are having high risk pregnancy, I'm going to be talking a little about that at the end of this video. So the first one I have to share with you is known as the dating or the Nucal scan. But what is this scan all about? This particular scan is usually done during the early phase of your pregnancy. It helps to determine how many babies are in your womb and also help with your estimated date of delivery. Normally, this scan can be used to detect the fetal heart rate at about 6 weeks. If you do the transvaginal scan, that's one you go through the vagina. And also between 8 to 9 weeks, you can do this scan and also check the abdomen to determine the heart, that's to hear the heart rate of the baby. But if you are a woman who have had previous history of ectopic pregnancy, I would advise you between 6 to 8 weeks, 9 weeks, you should get that transvaginal scan done so you are able to make sure that this baby is not growing somewhere else outside the fallopian tube. Okay, so in my trust, in my hospital, when I was pregnant, I had my first scan booked at 12 weeks. Because of my past history and all that, I had to do some transvaginal scan. Yes, that is another video for another day. So the first scan you do is the early weeks of the pregnancy to know how many babies are in the womb and also to know your EDD. You do it at the very stage. Then the second scan that is normally done is known as the Anomaly scan. It's usually done in the 20 weeks. In my hospital, when I got pregnant, they do this pregnancy scan at 20 weeks. Some people do it at 18 weeks plus 0 to 24 weeks. You can get it done. So what this scan does is to check for any abnormality. It checks the face, it checks the kidney, it checks the organs, all the organs in the body, just to make sure they are properly formed. It checks the blood flow, it checks the liver. And during this anomaly scan, guess what you detect? You also detect the gender of the baby. So during the 20-week scan, you're able to know if you're having a male child or a female child. So your radiographer is going to tell you. So when I went for my 20-week scan, they will ask you, do you want to know the gender of the baby? Trust me, I always want to know the gender of my baby at the very beginning, as soon as I can. So with Anomaly scan, you're able to know the gender of your baby and also know what to prepare when it comes to maternity period, when it comes to preparation for your baby. And the last scan, which is the third compulsory scan I advise you to do, is the one that is done at 36 weeks, which is the growth and development of the baby. This particular scan is to ensure that, okay, your baby is growing at a particular rate and is developing well like they expected. And also, to also check if the head is down or if the head is up. So now if it's a breech delivery, if it's a cephalic, this growth and development scan is going to help. And for those that are high risk, that are having high risk pregnancy, you may have series of scans in between. These 3 scans might not be enough depending on how high risk you are. So you might have scan done at 28 weeks, 31 weeks, 34 weeks, 38 weeks. So they might just tell you when to come out frequently for your scan, just to make sure you and your baby are doing okay. But you see that 3 scans I listed, if you are not high risk, please make sure you do these 3 scans. For the first scan, in my trust, they check for risks for Down syndrome, Edwards, and something called Pater syndrome. They check it and they send the results to your house within 7 days when you do that first scan. So these are the 3 scans I advise pregnant women to do. The first one is the dating scan. The second one is the anomaly scan. And the third one is the growth and development scan. All right. So thank you very much for staying tuned. Thank you very much for watching our video. Don't forget to like. Don't forget to subscribe. And also, don't forget to share with your friend if you got value. For all my returning subscribers, this is Nurse Mercy saying thank you. Bye and see you in our next video.